Tonight, we're addressing many issues tied to mental health. We begin with a big concern, brain injuries. Research shows those injuries can lead to more trouble down the road, especially if they are not addressed by a doctor. According to the American Journal of Public Health, 25% of people with a brain injury have suicidal thoughts within the first year of that injury. My next guest, Dr. Gary Seal of the Center for Neuroskills, has more information.
Sure. So neuropsychiatric disorders, in particular major depressive disorder, are frequently diagnosed within the first year of a brain injury. Research shows that about 50% of individuals with a brain injury will report clinically significant levels of either anxiety and or depression within that first year of injury. And along with depression can come suicidal ideation.
And so what would be the best course of action to deal with that before it becomes dangerous like that for an individual who may have that brain injury?
Sure. So one of the things that we do, obviously, is assess patients as they come in, take a full psychosocial history. And some of the questions that we want to ask include or assess their level of depression, level of hopelessness. That's a factor involved in suicidal ideation and attempts. And also if there have been any prior suicidal attempts. Some research studies show that individuals who have a brain injury and have a prior attempt of suicide pre-injury and are reporting high levels of depression and hopelessness after injury are at high risk for suicidal ideation and attempt.
And
so
when we
successful identification is very, very important.
And when we talk, Dr. Seal, about brain injuries, are we also talking about, and a lot of young people have to endure this when they play sports, concussions as well. Would you consider that a brain injury? And have you seen cases where athletes have maybe gone down the path of suicidal thoughts or even committing suicide?
Certainly. So a concussion is a form of brain injury. It's considered a mild brain injury. Individuals who sustain concussions often experience difficulty with fatigue, sleep disorder, irritability, their ability to concentrate or focus and retain information is altered. And generally speaking, these symptoms will resolve in about 4 weeks after a concussion, but these symptoms can interfere with daily activities, returning to work, returning to school, and so people can become depressed, can become anxious because of the changes following the concussion. Answering your question about particularly pro football players, there is a condition called CTE, and it occurs because of repetitive blows to the head. And we know from studies of professional football players, some of those had thoughts of suicide and did, in fact, commit suicide due to multiple concussions.
So it would be important if parents have young athletes that they have in their family and that may be playing football, that they pay attention to any injuries they get and their child's behavior as well down the road.
Certainly, and there are rules in place now because of concussions, UIL rules that require players, particularly high school and college athletes, to remain after the first concussion, to remain out of play for at least 1 week and exhibit no soft neurological signs at rest or during exertion. The second concussion is a mandatory 2 weeks out. And again, no soft neurological signs at rest or during exertion. If you have a third concussion, you're out for the season and must be reevaluated before re-entering play. So there are rules to protect players now, but certainly parents and coaches and trainers should be on the alert for any changes in behavior, cognition, emotion.
Go ahead, doctor.
Yeah, no, just be aware of those changes.
And once again, let's reiterate this and send this message home to the viewers out there. If you have had a brain injury and you're feeling different mentally, what should be the first thing you do if you have had a brain injury? You know you've had that injury, but now you're having thoughts. You don't feel like yourself. You feel like you're having those so-called suicide thoughts. What would be the first course of action you would tell them to take at that point?
Yeah, to report it, to let someone know that you're experiencing these changes, so that they can direct your care towards someone who can address it. Again, sometimes individuals will report depressive symptoms and may think about suicide, but or harming themselves, but they really don't have a concrete plan or the means to carry it out. They're just feeling very distressed about their current situation. It still needs to be addressed. However, those that have a concrete plan and the means to carry it out are at the highest risk and may need even short-term hospitalization.
All right, Dr. Gary Seal, who's the Regional Director of Clinical Services at Center for Neuroskills here in the Houston area. We want to thank you for your wonderful advice here on the Factor Uncensored, and hopefully we've helped someone out there who may be watching and they didn't realize exactly what was going on with them mentally, but hopefully we've put them on the right path, and thank you for your time, sir. The Suicide and Crisis Hotline is 988. It's open 24 hours. Still